Busy. Y'all playing jokes, but when y'all get to the end, y'all gonna be crying. I just want to tell you, okay?
As long as you're there to wipe some tears up.
I am, but that don't do nothing for your grade. Okay, so next week we're gonna bring in the cardiovascular sounds and stuff, right? So when we bring that in, you can kind of start tying everything together. But for the end result, it's gonna be kind of like the OSCE thing, whatever y'all's OSCE thing is, but with the mannequin or whatever, and you actually are not going to be doing it in a group. It's going to be one-on-one. Okay, so you're going to get like a scenario or something or another. So say like your person has a cough or a common cold or something like that, like we talked about today, or eye pain or eye irritation or whatever, and the ear drainage. Okay, for today, for instance. So if that's what your patient had, it's going to be where you're going to tie everything in. So you're going to come in, introduce yourself, ask a patient about the problem that they're having today, you know, a few little history questions or whatever. Then you're going to go into your assessment. So just like all of us have been to the doctor, right? You went to the doctor for stomach pain. What do? They go in, they ask you questions, right? How long you been having this? Any diarrhea? Anything going on with it, right? They ask you all the little questions. Then they examine you. That's really the gist of what this course is about. Just being able to identify the signs and symptoms and assess the problem, right? So, for instance, today, we had eyes and ears. If the person came in, they had redness in their right eye and some drainage in the right ear, whatever. Okay, so you're going to come in, hey, Mr. Smith, my name is Taylor. And you're going to say, you know, tell me a little bit about what's going on. And it's going to tell you what's going on. My eyes been bothering me, my ears been hurting, da-da-da. You ask a few little questions. You say, okay, well, let me take a look at you, right? Now this is an assessment part. So you're going to take your light. You're going to shine the light in the patient's eye. You're going to say, oh, the right eye presents with some redness, there's some drainage, people's reacting, left eye is clear, no problems, people's reacting, whatever. Then you're going to look in your patient's ear, tell me what the eardrum looks like over here, look at the patient's ear clear, no fluid, whatever the case may be. So you're just telling what you actually see. And on the scenarios, there are going to be some normal and some abnormal things that you're going to need to be able to point out. So, for instance, if your patient, for instance, had respiratory situation, cough, cold, or whatever, or asthma or something like that, we may put wheezing sounds on here and see if when you listen, are you able to determine if the patient is actually wheezing, right? So those sounds are on Blackboard. They should be, the cardiac and the respiratory sounds, so start listening to those to get comfortable with that. For today, as far as like the head, you're going to like, when you come in, you look at the person. If the person has an issue with the head or a headache or whatever, you just palpate the head like this. You're always inspecting. That's the first thing you're looking at. And so you don't see any bumps, lumps. You don't feel any bumps, lumps, or whatever. You don't see any bruising. The face is symmetrical or whatnot. Then you're going to palpate, like we did for today's lesson, was those lymph nodes. So you start here in the front with the pre-auricular here, the post-auricular behind, the tonsillar, the submandibular down here, and then the submental down here under the chin. Keep going down the neck like that, just kind of sideways. You just touch down the neck. And you can practice this on each other too when we're in the other rooms. But just go down like this. Then you use 2 fingers to kind of make sure you check the trachea. Then you can use these 2 fingers here to kind of feel for the thyroid, which of course you're not going to feel, but this should be the area in which you should feel it. So the neck goes down like this, then you go down like this. You can have the patient swallow for you while you're doing that, and then palpate for the thyroid.
So it'll just be like one encounter basically. It won't be
like
we have to do every single.
No.
Okay,
but you're gonna have to know it because you don't know what
right.
you're gonna
so you don't know what
get.
you're gonna get, but it's just gonna be like one thing's gonna pop
right.
up.
And we all have to do vital signs.
Everybody has to do vital signs, and that means that I think we've said between plus or minus 2. So if we have it set for 138 over 97, and you get 140 over 97 or 99 or whatever, you still get it, right?
Cool. Oh Lord.
So you just gotta start practicing as you're learning things. Go home and just start practicing.
Thus far, we have learned how to listen to the respiratory sounds.
Well, we're gonna probably get more into that in the next coming weeks.
So,
but really, right now, all we've learned the vital signs. Vital signs includes the blood pressure, heart rate, respiratory rate, temperature, right?
Temperature. When did we learn temperature?
But temperature is just, we've all done it. Temperature is easy. Just put it under the tongue, right?
Was it
98.6? Yeah.
Okay.
So right now, so far, we've learned vital signs. We've learned our cranial nerves, and we've learned eyes and ears, and the head and neck. right?
So if we want to set up a session with you to like run through everything, how would we go about that? Do you want us to email you or?
Yeah, you can email me and see. It's probably only gonna be on this day.
Yeah,
but
like
you
what
guys
days
are
is best
busy.
for you? Like time periods.
Next week I can be unbusy.
Okay.
On Tuesday.
Tuesday, like, I mean, I could be here as early as 10.
Oh, we're here at 7 a.m.
10 a.m.
We got class.
Yeah.
Y'all have class, right?
Yeah, we got
What do we
class.
have? Kyle?
We would have,
On what day?
could
Patho
we
and
say
calc.
after this class?
Patho,
You can
calc,
stay
pharmacy
after, yeah.
prep.
Oh, okay, that's probably the best.
Okay, yeah, we'll stay after class next week.
Yeah.
Yeah, you can say that.
Knock it all out.
Private session reserved.
Could you